Hello, everyone. We are here in MARAdvance with a guest that is Dr. Eduardo Cervi from Italy, Milan. He is enthusiastic about new technologies, advancing in ultrasound diagnosis. And we have some questions for you.
Yes,
The
thank
first,
you very much for this invitation.
the first one is why you are here. What it's going to be your presentation about?
Yes, my presentation in this meeting, Mara Advance, I think that is very interesting because I'd like to present you a new technology about vascular ultrasound. Usually, the patient goes to the hospital to check with the ultrasound, but now in these years is the technology that goes to the patient and not the patient go to the clinic or hospital to check vascular problems.
Right.
Right. I love this theme because I do the ultrasound vascular surgery, vascular. And the second question is tell us about the new project and this is a reality to Brazil?
Yes. Now, this technology that I present in this meeting is very, very new technology. Okay. I performed for the first time ultrasound. I was in Barcelona, and the patient was in Shenzhen in China. And I perform a vascular check, carotid problem for the carotid problem, for the aneurysm problem, and offshore for the arteries and veins of the legs. And it's incredible that this robot can perform all the vascular problems or other problems, for example, abdomen or osteomuscular or gynecologist problem. Yes, in a real time, you can speak with and see the patients. They stay in China or in another country, and you can perform the ultrasound in totally security, and it's very very nice technology.
When do I do it, please?
Okay. Uh, I told you that this is very new technology, and in fact, there is a second machine, a second device, and I think that is possible in the next month to come to Italy to see this technology, to improve your ability in this field.
I appreciate.
So this is a robotic system, right?
Yes, this is a robotic system. You can perform all the ultrasound problem at distance. It's incredible the low latency. So you move the probe. You can stay at home in your room, and the patient stay in a little area, rural area in the little city, and immediately you can perform all the vascular problems. Of sure, is with the intelligence, artificial intelligence, and you have to have the 4 or 5G connection. This is sure.
In Brazil, we have some training courses on hands-on ultrasound. What's your vision about the future of education in this field? Training ultrasound is in next years becoming less important because of these kind of devices that will bring us these facilities. What do you think about
Yes.
it?
I think that the technology run fast, and I have I think that mm, in the future maybe the robot with artificial intelligence can take the place of the doctors. For example, I am a vascular surgeon, and and the general surgeon, and the open surgery. Now there is a laparoscopic, and then robotic surgery. I think that in the future, the robot can take the place of the
Yeah,
doctors.
I think so. And about the price, is very expensive or not?
Yes, for the moment, it's very expensive. It's very, very expensive. Yes. But you know that for all new technology, the first price is very high. I think that in the future, this
Yes.
technology is possible for everyone.
And this device is only used for vascular examinations, or another specialties can bring this device.
You can apply this technology, this robot ultrasound, for many pathologies, not only for the vascular disease. For example, now the study is about the gynecologics problem for the abdomen. If you have a problem of kidney, liver, you can check with the correct probe. You can check all the abdomen or the thyroid also. You can apply in many field.
Excellent.
It's amazing. I imagine about DVP.
Yes, absolutely, absolutely. The idea is it's correct. Your observation. If you have a urgent problem, the patient that go to the hospital, but the patient so that you can try with this new device.
In the little series so far,
Yes, yes, absolutely.
this is the goal.
But for example, you know that for the ultrasound, you can try it with just a little probe and the iPad.
Yeah.
And the iPad. Now I was in Maldives, for example, to uh, to make a course about ultrasound with just a little probe and the iPad, because in this country you have many islands, many islands, and the problem is if the patient has a suspicion of thrombosis, the patient take the ships and go to in a big island where there is the hospital. But with this technology, just a little probe and the iPad, the the doctor in island can make a diagnosis. And I try another technology. The name is Think Sono. This technology is fantastic. Why? Because doctor, but not doctor, also a nurse, for example, a physician, take the probe, and move the probe. For example, for the thrombosis, for suspicion of thrombosis, you check the femoral vein, popliteal vein, great saphenous vein, for example, and the artificial intelligence when can tell you if the patient has the suspicion of thrombosis.
Wow. This is absolutely amazing.
Amazing.
This is fantastic.
And this idea came from COVID pandemics, right?
Yes, this technology was born during the COVID. For don't touch the doctors, don't touch the patient, and the doctor can stay at home, not in hospital, home. You move the probe, and the robot move in the patient without touch the patient, but you can speak. You can see the patient, and the patient see the doctor and can speak with the doctor.
Could you show us a little?
Yes,
Mostrar um pouquinho, né?
this is my experience in my center. I check 100 patients for vascular problems, carotid and aorta and arteries and veins of the legs. We take 100 patients, all the patients check with a normal ultrasound and with this robot. And we speak with the patient. You prefer the doctor or the machine or the new device? It's incredible. Because the problem when I try for the first time this technology is, but when I press the probe, the patient, what feel the patient? This is the problem, no?
Mhm.
And I ask to the patient, for example, for the aorta, I have to press to looking for the aorta. And the patient told me, doctor, the machine, the robot is better than you.
Well,
It's incredible, huh?
incredible.
It's incredible. No pain, no problem. The robot is better than you. This robot has security. For example, when I check the aorta, if I move to speed and I touch, for example, no carotid area, but the face, the eyes, the robot understand this problem and stop immediately the exam and come back in the normal position. You have more security. Okay? Yeah, this is very interesting.
Very interesting. Amazing. Absolutely amazing. Thank you for bringing this new technology, so much knowledge for us. I appreciate.
Thank you very much.
Thank
It's
you.
a pleasure.
You're
It's a
very
pleasure.
welcome in Brazil.
Grazie. Grazie mille a tutti.
Muito bom.
Beh, prego, prego.
Eu tenho um presentinho para você.
Oh, grazie. Che bello.
Vamos gravar aqui.
Um presente, it's a gift
Yeah.
from our team, that is the pelvic team. It's like a butterfly in the pelvis format.
Yeah.
So
Is
it
it-
brings the idea of metamorphosis, the butterfly effect, that a local act can bring us new advances and awareness about the pelvic venous
Genial.
disorders. So
Oh, thank you very much. Grazie mille, muy obrigado. Che bello, grazie.
grazie.
Grazie mille.